I can't imagine anything that could shock me. Certainly nothing that could gross me out. I can tell you that. There was an ad one time for a local clinic that said something like, your most embarrassing moment is our Tuesday.
Welcome to the Women Inspired Podcast, brought to you by Modern Well, a beautiful woman-centered collaborative workspace in Minneapolis, Minnesota. I'm your host, April Seifert, psychologist, entrepreneur, and self-proclaimed life experience junkie. Each week, I will introduce you to a different woman who is succeeding and inspiring others in one way or another. We'll dive into her story, her successes, failures, and the lessons she has learned along the way, all with the goal of inspiring you to listen to that inner voice who keeps reminding you that there is something you want to take action on. You are so much more capable and powerful than you give yourself credit for. Inside of you is a woman on fire. Let's let her out and see what happens. Here we go. Hey everybody, welcome back to the Women Inspired Podcast. My name is April Seifert and I am your host. And this week, like every week, I am bringing you an amazing, inspiring woman. But before we dive into that, I want to talk about the fact that I hit the explicit button on this episode. I reluctantly hit the explicit button on this episode. And here's the thing. Today's episode, in full transparency, we're going to be talking to Dr. Kelly Culwell. She is an OBGYN, and we'll be having a very straightforward, candid, open discussion about women's health and all of the topics and body parts and things that come along with that. Now, I hit the explicit button because I never know who's going to be in the room with you when you're listening to my episodes. I don't know if you're going to have earbuds in, if you're going to be listening to Bluetooth in your car and everyone in the car can hear. And in particular, I don't know if there will be little ears around. And that's why I hit the explicit button, because I wanted to let you know, hey, maybe take a peek at this episode before you just blast it out there. Now, here's why I was a bit reluctant. Kelly and I, Dr. Culwell and I, get into a really important discussion around why there are so many myths and why there is so much confusion about women's health. And one of the main reasons why is that we are trained to be ashamed of our own bodies and ashamed of our own health, and we're ashamed to the point that we don't ask questions and we don't openly talk about it. So I was reluctant to hit the explicit button because I'm like, am I just adding to that? Like by hitting the explicit button, am I somehow signaling to my audience that we're going to be talking about something that's kind of lurid or maybe shouldn't be discussed openly? And that's the opposite of why I was so excited to have Dr. Culwell on this week's episode. So again, I want you to know that I hit the button just to sort of signal to you, hey, there's a topic here that you should look at before you just listen wherever it is that you tend to listen. But that being said, this is a topic that deserves to be spoken about openly. We deserve to be able to talk about our bodies, ask the questions we need to ask, get the information we need to get in order to take care of ourselves. And there's nothing shameful about that. There's nothing shameful about our bodies. There's nothing shameful about what happens to them in terms of health conditions that might come up. And there's nothing shameful about us asking the questions we need to ask in order to make sure that we're taking care of ourselves and doing right by our bodies. So it's a very long-winded way to say I was very conflicted about that explicit button this week, but I hit it, and that's why. So, all right, let's dive into the amazing Dr. Kelly Culwell. I was so excited to have her on. Her online name is Dr. Lady Doctor, and she is a fellowship-trained OBGYN, and she is so passionate about women's healthcare. That's the whole reason why she went into this field. She has over 17 years of experience in women's reproductive health, and she has worked with so many organizations, both in the United States and internationally. She was the medical officer for the World Health Organization in Geneva. I mean, come on now, like that's amazing. and senior medical advisor for the International Planned Parenthood Federation in London. So she has just this incredible background in women's health and so much information to share with us that is just practical and very candid and open today. So I am so thrilled for you all to meet Dr. Kelly Culwell. Kelly, I am so excited that you are joining us for this episode of the podcast. Thanks so much for being here.
It's a pleasure. Thank you.
All right. So we are going to have a really fun chat today, and I'm really excited about your content area because you are an expert in something that is very near and dear to women, for sure. And so by way of diving into that, help us get to know you a little bit. Tell us a little bit about yourself and about the work that you do.
Yes. So I am an OBGYN. I have been in women's health for, 17, 18 years now. I also have a master's of public health. And so I have focused a lot of my career in sort of education and both international and domestic public health around women's issues. So I've worked for the World Health Organization. I've worked for International Planned Parenthood Federation. I've worked in academics. I've worked in nonprofits. And currently, I am the chief medical officer for a company called Evofem Biosciences, which is working to develop sort of novel contraceptive methods for women who can to be able to sort of control their own fertility and destiny. I am a mom of a 9-year-old boy. And I'm actually surrounded by boys at home, but my passion is women and women's healthcare. And I went into OBGYN really because I wanted to work with women, educate women. And so I've really tried to spend my career doing that.
I love it. That is such a great background, and the work you do is so important. And what's interesting about it is that I feel like this area, and one of the reasons why I'm really excited to have you on, it's something that impacts all of us, right? Like our women's health impacts all of us, but it's also an area that I feel like there's a lot of gray areas, and there's a lot of misconception, and there's a lot of question marks and things that seem ridiculous that they still exist. And so I think we're going to have a really cool conversation today. Can you talk a little bit about how you got into the field? Like you mentioned that you were passionate about helping women, but I've always wondered and wanted to ask my OBGYN, like, what was it that made you want to go into this field? It's just one of those that, I don't know, not one that I thought of when I was a kid, when I was thinking about what I wanted to be when I grow up. So I'm curious about, where that passion comes from and now how it manifests in the work that you do today, like where you see yourself making the biggest impact that you're making.
Well, I actually have a really great origin story, as all good superheroes do. When I was a medical student, I was doing so in medical school, you learn how to do pelvic exam. Believe it or not, you learn how to do pelvic exams on women who are paid to teach you how to do pelvic exams on them. So they're model patients.
Oh my gosh. Okay, like imagine that job. Also another job that I never would have thought to have when I was a kid.
Exactly. And these women they're remarkable, actually. They know so much about their bodies, as you might imagine. They can tell you when you're touching their ovary, they can tell you, they are really in tune with their bodies, and they are really excellent teachers. But yes, I agree with you. Not necessarily something I would do, but they're really good. And so when I did my first pelvic exam as a medical student, I inserted the speculum and I saw the cervix. And believe it or not, I had a moment where I was like, this is the most beautiful thing I've ever seen. I cannot believe
Really?
I was. I just thought it was amazing. It just sort of popped into view and I was like, oh my God, this is amazing. And from then, it wasn't instant that I decided that I was going to be an OBGYN, because at that point I was still thinking I was going to be a pediatrician. But I really, just that moment kind of changed my perspective. And I thought, I want to look at cervixes for the rest of my life. And the more that I, spent time in my OBGYN rotations and, talking with women and spending time with women, I realized that that's absolutely what I wanted to do. I wanted to, devote my career to taking care of women. So that's really it. I was fascinated and mystified by the cervix.
I love it. No one has ever said that on the podcast before. That is like the first time that sentence has been uttered on the podcast ever. So that's great. You win. Number one.
There we go. Okay, good. I'm glad I could add something.
Totally. I've interviewed a lot of people and this is the first. What I think is really cool about that is for folks who are listening, I mean, how many times across your life? Sure, it starts when you are reaching adolescence and all you and your friends are sort of looking around, wondering who's going to get their period and when is it going to happen and what's it going to be like, and all the crazy, misconceptions start swirling. And you think about that as being, something that happens with like adolescent girls, right? And then we grow up and we become adults and we just sort of know what's going on and we have the real facts and we have the real information. But that's, in my opinion, so not the case. Like super not the case. And I can't count the number of times throughout my life, whether it was having to do with getting pregnant, being pregnant, delivering a baby, your body afterwards, where over and over and over throughout my adult life, I've run into these brick walls where people are like, oh yeah, we just don't know the answer to that. I'm like, how? We're like half the population and all of us have a vagina. Like, what? And so it just amazes me. And so I love that you focus on this work because it seems so fundamental, but it's also something that's very gray for a lot of us.
Well, it hasn't been very long that the FDA required women to be included in clinical trials to get drugs approved.
Right.
So we haven't really been doing much research on women's health issues for very long. And so there are still a lot of unknowns. I mean, obstetrics is one of those areas that people are constantly amazed, of how little actual evidence we have for what we do.
Right.
And the same goes for gynecology and really all things women's health, is that there just hasn't been, the degree of focus on women and women's issues, despite the fact that we are, half the population.
Well, right. And then think about, it's almost two sides of the coin, right? We're told all the time, like, our bodies have these special hormones and they're so unique and so different and they're so different from men's, and we have a period, or some of us do, and whatever. And look at how different and special and unique you are. Yet drug trials and the development of so many treatments, it's like, oh, we'll just do that on men because whatever, it'll translate. And it's like, you don't get to say both of those things at the same time. Like, those are mutually exclusive. Either we're special and there are unique ways that our body works, or we're not. Like, one of the two. You don't get to say both things.
Absolutely.
That's just crazy to me. So yeah, so many areas that we are very not clued in about. And one, I'm going to go right to the most fundamental. And it was something we chatted about a little bit before we hopped on to actually record. There are so many, I feel like, misconceptions about the vagina itself. And even just saying that word, I promise you, like, half of the people who are listening to me are like, go, she said it out loud on the podcast. There's so many misconceptions about that. But you have great information to share. And so I'm wondering if you can kind of give us like a vagina 101 a little bit, like one of the most fundamental parts of our body that we just don't completely understand, likely.
Absolutely. And if you want to really freak your podcast listeners out, I'm going to say the word vulva. Which just like blows people's minds, because we're getting a little bit more used to saying the word vagina because it's constantly in popular culture, right? So my favorite thing is, oh, she was wearing a short skirt and not any underwear and I could see her vagina. Well, let me just say, you probably didn't see her vagina. And the reason is that the vagina is the inside part. The vagina is the part that goes inside. It's the tube that goes from the outside of your body up inside to your cervix and uterus. So unless you had a speculum and you were looking inside, you probably didn't see her vagina. What you probably saw was her vulva, which is the outside part. And people, for some reason, the word vulva, I heard someone say, oh, that's like moist. That's like, they don't like the word. It seems really gross for some reason, but there's nothing gross about it, just like there's nothing gross about your vagina. So the vulva's outside part, it consists of the labia, which is most women have an outer labia, the outer lips, and then the inner lips, the inner labia. And the shape and size and color of those labia can be dramatically different from woman to woman. And there's not one right normal way to look, which is another whole topic that we could talk about that I will abstain right now. But then the vagina, another thing that's really important to understand, and women don't always know this, and there's no shame in not knowing this because we don't teach girls about the outside of their anatomy. I don't know if you remember sort of sex ed, you can remember sort of that ram's head picture of the uterus and tubes and ovaries. And that's
oh my God, that's exactly what it looks like. You're totally right. It looks like a ram's head.
Yeah, that's the only part of your anatomy that you ever see in sex ed. And the only thing I can imagine is because anything on the outside makes people really uncomfortable because it becomes maybe quote unquote pornographic, but the outside is so important. So you've got your vagina, and here's a top tip. You don't pee out of your vagina. You have another hole called the urethra, which is above the vagina, and that's where the urine actually comes out. So a lot of women get confused about whether or not they have more than one hole. So you've got your urethra, you've got your vagina, and you've got your anus. And so a lot of times we talk about the 3 holes of female anatomy. And it's really important to understand that, because when things go wrong with certain parts, you need to know sort of what it is that is the issue. The other very key thing that we talk about with the vagina is the fact that it really is self-cleaning. So vaginal discharge comes from both the cervix, which is at the top of the vagina, and from the vaginal walls itself. And the purpose of vaginal discharge is to keep the vagina sort of clean. And you have bacteria that live in your vagina all the time. It's totally normal. And you have both good bacteria and bad bacteria. And most of the time, the good bacteria are winning the day, and they are keeping your vagina in a nice, normal range of the pH, and everything's going great. Now, if things get out of balance, sometimes the bad bacteria can overtake the vagina. But for the most part, the vagina itself is sort of a self-cleaning thing. So you don't need to put anything in it to clean it. You certainly shouldn't add any scents or deodorizing or anything like that, because that really can just lead to irritation.
And so this is even beyond us not being told these things. We're actually actively told the opposite. Like, we're actively marketed to so as to believe that we need those products, that there's something deficient that we need to fix down there, and that's why we need special cleaning products that you squirt up there, or scented something or other that you would put on it.
Well, it's a lot about shame, right? So we are taught from early age that the vagina is gross and smelly, right? And that we need to somehow cover that up or fix it. A normal, healthy vagina that does not have an infection, it has an odor, it has a smell, and it's different from woman to woman to woman, and it's different throughout the course of your menstrual cycle. And that's normal. It's completely normal. Now, there's some odors that are not normal that indicate infection, and that's something that, definitely it's important to know what your normal sort of smell is, so that you know when it's gone abnormal. But there's nothing wrong with the normal, healthy smell of a vagina. And unfortunately, we are taught to be very ashamed of our anatomy. And so part of that is the marketing of products, to make us quote unquote clean, or have that not so fresh feeling, right?
Right. Yeah. Well, and that's something that is so frustrating to me, because I get really fired up about issues of situations where things are not fair, situations where things are not fair is the right word, because not always are things equal, but fair maybe is another way, or egalitarian maybe is another word for it. But when we put so much shame on women about their body parts, that leads to this situation that we're in where we don't know what the outside of our body is called because we're so ashamed of it, and it should be covered and not talked about or touched or whatever. And it leads to situations that actually impact our health in these positions that we're in where we're grown women and we don't understand how our bodies work. And that's just wild to me.
Yeah.
It's just wild to me. And it leads to, you mentioned the word moist, and I'm going to say it 5 more times. Moist, 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 moist. Because it's funny because you think about why that word is gross to people. And they'll say, well, it's like the word panties. I don't like that word either. And I'm like, well, what do those things have in common, right? They have the fact that they have something to do with your vagina and your vulva is what they have in common. And that like triggers this gross reaction to us. And that's sad because that's a part of our body that we're trained to hate or be grossed out about.
Yeah. And it also keeps you from being honest with your OBGYN, or sometimes even going to your OBGYN because you're so ashamed. I mean, I can't tell you how many women, come into the office and say, oh, I'm so sorry I didn't wax, or, I didn't shave before I came in. And I'm like, are you kidding me? Like, I don't care if you wax or shave, it doesn't matter to me at all. But it's sort of, they're apologizing to me for, having been at work all day. And so they couldn't shower immediately before they came in or whatever it might be. I mean, obviously hygiene's important, but I mean, we're not talking about that. We're talking about people who are really ashamed of what their natural body looks or smells like. Mm-hmm. And when that comes through, even when you're interacting with your doctor, that actually can be detrimental to your health.
So let's talk about that a little bit because, a lot of us go to a regular appointment with some regularity to an OBGYN, or at least it's suggested that we do. What else do you see in those appointments? Because I feel like that's your time. Like my OBGYN is my primary care physician, or that's at least how I use him. And that's kind of the time to get questions answered and really make sure that things are going well and make sure that you're taking care of preventive care. How can we do that well? How can we make the most of those appointments when we come to see our OBGYN?
Yeah. So I have a few tips that I kind of recommend because you don't have a ton of time, right? And so what you need to prepare, it depends a little bit on whether or not you're coming in for like a routine appointment versus coming in for a problem. But some of the things are kind of standard across the board. So the number one thing that I always recommend is know your last menstrual period, right? So it's almost like the first question you're going to be asked when you walk in the door. And frankly, if you're not asked, you should volunteer it because a woman's last menstrual period really should be thought of as a vital sign because it indicates sort of the health of the hormonal system of a woman, and not only the hormonal system, but the anatomy as well. Now, some women are not going to have menstrual periods because of medications they might be on, like hormonal birth control or other things, and that's fine. Some women have irregular menstrual periods because of medical conditions, but that's important for your healthcare provider to know. So I just couldn't recommend more that you get some sort of either period tracking app or put it in your phone or something like that, because number one, it's important to know if you're having regular menstrual periods. And a lot of women, I mean, all of us, me included, if you had to think back and not write these things down, you'd be like, well, I think I had a period a couple months ago, or maybe it was last month. I'm not sure. And that's really important because number one, we got to make sure that you're not pregnant, and number two, if there's something going on that's causing you to miss menstrual periods or have irregular or even more frequent menstrual periods than kind of normal, we need to maybe evaluate that. So that's really important. Some other key things is if you're coming in for a problem in particular and you've been seen by another doctor, or if you've had tests somewhere else, please try to see if you can get the records in before your visit, because a lot of time is spent in the visit trying to figure out what happened in the past. And if we could have that information ahead of time, it actually will keep you from having to come back again. Because a lot of times, if we don't have those records, we'll say, oh, well, if you had an ultrasound, we'll just get that record and then we'll have you come back. Because we need to have as much information as we can to, help make the best informed treatment plan or, need for further diagnosis. So that's something that women don't, or people in general actually don't think about. But in our sort of unfortunately fractured healthcare system, it's really hard for doctors to get access to records unless it's impossible for a doctor to get access to records unless the patient requests them. Mm-hmm. And if you could try to do that ahead of time, that's a lot better.
Yeah.
The other thing that I also recommend is, in addition to keeping track of your period, if you're having any symptoms that you're worried about, try to keep track of those symptoms. Like, keep track of them, start writing them down. When do they happen? What makes them better? What makes them worse? How frequently does it happen? Particularly if you're having pain, where is it? Does it radiate? How severe is it? Can you characterize it? These are things that if you can keep track, kind of keep a diary of these things, because most likely you've called and you've made an appointment with your doctor and you're having to wait, maybe a week, 2 weeks, maybe longer. During that time, really try to pay attention to these symptoms, because that really will help guide where the doctor can go to try to figure out what's going on or to try to treat what's going on. Mm-hmm. And the final thing I would say is similar to the healthcare records is I always recommend people sign up for electronic healthcare record access. So, things called MyChart or something like that, because that is a really good way to interact with your healthcare provider in a secure manner, between appointments, and to make sure you can get access to your lab results, and, you can actually track your weight or your vital signs over time in those websites. So that's another thing I really highly recommend as well.
Totally makes sense. And where my mind goes to, this is really, really helpful to think about, how we can get as much done in, like you mentioned, a short amount of time as short amount of time as possible, because we don't get a ton of time in front of you, in those appointments. Something else that I think would be interesting to hear from you about. So my husband, in full disclosure, my husband is an ER physician, and he sees a lot of stuff, a lot of stuff. And it's really funny where his threshold is now after working in the field for quite a while, where his threshold is now in terms of things that will shake him up or shock him. I would imagine you're in a similar situation. So someone comes into an appointment and in their mind, they have a question that is mortifying. Now, not only are we ashamed of our vulva and our vagina, but I have a really crazy question about it, or something that has to do with my body, and I'm feeling really anxious about asking you. I'd love to hear from you in that perspective, because I definitely know what my husband would say, but this is a little bit of a different domain.
Absolutely. But you're absolutely right. There is, I can't imagine anything that could shock me. Certainly nothing that could gross me out. I can tell you that, as it relates to women's health. Now, I went into women's health for a reason. There are certain things about men in particular that do gross me out. But women's health, nothing about women grosses me out. And so, yeah, there was an ad one time for a local clinic that said something like, your most embarrassing moment is our Tuesday. It really is. It's what we do. It's what we do for a living. And frankly, hearing what it is, we would far rather hear what it is and kind of upfront than go down a path that is not going to be helpful to you, or completely miss something and end up, seeing you months later for a much more severe problem. Mm-hmm. So we absolutely, want to hear those most embarrassing, most gross, most shocking questions because it's really important. I mean, just as a perfect example, sexual practices, we really need to know, and a lot of healthcare providers are getting better about proactively asking about sexual practices, but we need to know some of these things because it actually impacts the type of tests we need to do. So for instance, if we're screening you for sexually transmitted infections, we need to know where to screen you, what parts of your body need to be screened. That's really important. So absolutely, I know it's easier said than done, but just know that women's healthcare providers have gone into this field because they love taking care of women, and because they see so many women, they have seen it all. Or if they haven't seen it all, if you are able to bring up something that they have never heard of before, it certainly is not going to gross them out.
That's amazing to know. And that's amazing permission to be able to go in and ask the questions that we want to ask, and that we need to ask in order to make sure that we're as healthy as possible. Because, I mean, it's the embarrassment side of it is one thing. I mean, that's definitely there, but also the training that we get culturally to not be a burden and not ask too much of people. I think that comes into play too, where we feel like we don't want to be a burden on you, and we don't want to keep like dragging things out and keep asking because, maybe you need to get on to the next thing or whatever. Like we're just being kind of a burden.
Yeah. And, leave it to your doctor to, and don't be upset or, if your doctor says, look, you know what, I don't have time to address that today, but we'll bring you back and we'll address that in another visit. Don't feel bad about that, because it is true that there is a limited number of hours in a day. And, the more the doctor, spends extra time with you, the later they're going to be for everybody else. And so there might be a point at which when you bring up something, if they don't have time to address it today, they'll have you come back. Or maybe we can get some tests and then have you come back. Or maybe, I'll ask you to take a diary of these things between now and 2 weeks from now when I see you again. But the important thing is to start the conversation. It is true that, we might not be able to take care of everything on that one visit, but it's important to start the conversation so that we know what you're going to need from us in the future.
Mm-hmm. Totally. And one of the things that, came up in my recent past as I was talking with my OBGYN. I had a baby 6 months ago, and that, I mean, think about like you've grown an entire life in your body, and one way or another, it has come out, and each of those ways has its own situation to handle. But the aftermath of that, say the year or two, or sometimes more, I would imagine, after your body goes through something like that, it's just weird. I mean, the stage I'm at now is like the weird stage where big clumps of your hair fall out like every day. And so, rest in peace, everyone's drain. If I take a shower at your house, my poor house, I mean, there's just no way of avoiding it. I mean, my body is just like expelling hair. It's disgusting. But there's so much that happens after your body goes through something like that. And I was speaking with one of the physicians that I saw after I had my most recent baby, and something she's really passionate about is pelvic floor and all the related things, because that's one of those areas where repeatedly, this happened before I had kids, I heard this type of stuff while I was pregnant, and then since then, it's this assumption that there are just certain symptoms that, oh, yeah, of course we have that. I had a baby. And like no one thinks to question. And in here, I'm talking about, if you pee when you laugh, or you pee when you jump up and down, or you sneeze, or any of those other like weakened pelvic floor symptoms, everyone just passes them off. Like, well, of course. I mean, everybody does. And there's nothing wrong, and there's no way to fix it. And I'm curious about your take on that and what info you might have to share with us, because it is super pervasive. And maybe it's top of mind for me because I just had a baby, but still.
No, it's such a common issue. It's really interesting because in my OBGYN residency, I would say I learned almost nothing about sort of well, as an example, pelvic floor physical therapy, which is such an important way to rehabilitate your pelvic floor muscles during the whole course of your life, actually, but particularly after having a baby. And in France, it's actually part of routine postpartum care.
Yes, that
pelvic
book.
floor
There's a
physical
book
therapy.
called, I think it was this book, Bringing Up Bebe. I think it might have been in that book, part of it, where she talks about how like she had to go to the doctor and they put this like thing in her vagina and it like measured her, how she was able to contract in certain ways. And she's like, I'm terrible at this. Like I couldn't do it. It's just amazing.
Yeah.
I had never heard of that.
Yeah, absolutely. It's sort of the biofeedback part of the pelvic floor physical therapy, and it's such an important. I mean, the pelvic floor is such an important part of your entire body. So it definitely impacts your ability to hold your urine and your stool and your gas and all of that. But it also is so related to issues around pelvic pain, to core strength, to back pain. There's so many issues that the pelvic floor impacts. And it's such an important part of our anatomy that we don't talk about in lay culture. To be honest, there's very little discussion of it, even in medical training. And until recently, I think pelvic floor physical therapy hasn't really been something that is sort of part of mainstream medicine. And I actually learned about it from a nurse practitioner who was really good at doing, assessing sort of the pelvic floor as it relates to women who come in with pelvic pain. And, I just became more and more convinced that pelvic floor physical therapy has such a huge role in treating a wide variety of women's health issues because the pelvic floor is attached to everything. And and I think just because women's issues have been not talked about, so shameful, and then women are just expected to sort of suck it up and deal with it. We've not addressed these issues in a way that that women feel comfortable talking about them because they don't think there's anything that can be done.
Right. And all you hear repeatedly when you're both pregnant, sometimes during the delivery. I mean, you're going through a thing then, right? During the delivery. And then afterward is, all that matters is that the baby is healthy. And I will admit, like, I was very concerned and very focused on making sure that that baby was healthy. Yep. But you're a human being with like health needs as a result of all of that as well. And so I think we're so conditioned and we're told over and over and over that all that matters is the baby's healthy. All that matters is the baby's healthy when it isn't. And we just sort of, I don't know, suck it up and move on and keep taking care of everybody else, not even realizing that I pee a little bit when I sneeze. That's like the tiny symptom of a bigger problem that can also manifest in much bigger ways, like you mentioned, back pain and other things like that, that are a way bigger deal than just, I pee when I sneeze. It's like, it's so much more than that.
Absolutely. I mean, I think the great thing about OBGYN, the practice of OBGYN over the last, I don't know, maybe up to a year, a couple of years maybe, is we're finally starting to understand the importance of taking care of the woman in the postpartum period. So it really is, we do this whole 9 months of obstetric care, and, we're really trying to remember that we have, two patients. We've got the woman and the fetus, and, we're trying to do all that. And then in the postpartum period, traditionally, the baby comes out. I mean, how many sort of memes and silly things have you seen? This woman just laying there, with no one paying attention to her and everyone crowded around the baby. And there was a really great series by NPR and ProPublica about, the maternal mortality and the fact that, through our emphasis on the baby, women are dying in the postpartum period. I mean, not just, having issues with incontinence, but I mean, literally dying because we had this misperception of things like preeclampsia, that once the baby's out, women can't suffer from preeclampsia anymore. Well, that's absolutely not true. And so, or bleeding or whatever it might be, there are real health problems from the absolute, crisis problems to the longer term health problems that are so important to address in women after the baby is born. And I really love this idea of the fourth trimester, and that first 3-month period of time. And frankly, it goes on longer than that. But at least if we can just focus on the fact that women need extra special care in that first 3 months after birth, just like babies do, I think that would go a really long way.
Oh gosh, yeah. And something that I'm really, and this maybe starts to diverge from your specific focus, but it definitely, you're the first catch. Like, you're the first person likely who would be able to notice this, is something that I'm super passionate about, is mental health after women have babies. I shared a podcast episode a while back. A better podcast host would be able to just tell you the number, but I didn't know we were going to go here, so I don't know the number. But if you go to my website and you search for postpartum depression and postpartum anxiety, you'll hear me tell my story of what it was like to go through that with my first daughter. And this is another one of those areas where it's shocking to me how little we know, because in my case, and this is just me, one human being, one person, I would go into my physician and I would perfectly honestly, I mean, kudos to them for asking me the questions every time and giving me the sheet that you fill out every time you go to the doctor to make sure that, you don't have symptoms of postpartum depression. None of those questions applied to what I was feeling. They didn't. Like the question about, do you still enjoy things that you used to be able to do? I was like, oh my God, please, can I go do them? Like, I want to run away from my family and go do those things. I would be so happy. But none of the questions that I was filling out perfectly honestly were able to point at, this woman is not okay. Like, she is severely not okay. And it wasn't until I, as a psychologist, like sort of had a moment of clarity where I was like, this isn't depression. This is anxiety. This is anxiety, and I'm starting to develop PTSD about it. Oh my God, this is exactly what it is. And I went in and said, I want this. I want treatment for this exact thing. And it wasn't until then that we figured it out. So that period after you have a baby, there's so much that, not to scare anyone or whatever, but just more to say, you're worth it too. Like, your life is worth it, and your health, mental, physical, all of it, it's worth paying attention to, and it's worth being very gentle and caring toward yourself in the same way that you are that little baby. Like, you guys went through a lot together. You went through a ton together, and you're both kind of trying to find your way out of the crazy that just happened. So
absolutely,
it's just something I'm so passionate about, to make sure people, like, I mean, God, please listen to my story. And if any of it resonates and whatever, please go talk to, your doctor and make sure that you're getting help, because holy bananas, like, there is such a bright light on the other side. But you do need, I definitely needed help in a variety of ways to get to that point.
Well, and it's so important to share your story because, I think rather than scaring women, it's important for women to know that other women are experiencing these same things, because you feel so alone. Because you're made to feel as a woman that if you're not like jumping up for joy and you don't have the immediate, like, I have more love in my heart than I've ever known possible, the minute the baby is put on your chest, that something's wrong with you, that you're not normal, that you're the only one that's ever felt this, that it's all supposed to be sunshine and puppy dogs and rainbows. And I didn't, I was an older mom when I first had my baby. I was an OBGYN, and I still had that feeling that I was the only one that had ever been through this. And when I started to talk to women afterwards, and they're like, oh yeah, no, that's all. And I'm like, why doesn't anybody talk about this before? Like, why don't people talk about the fact that it's not all sunshine and puppy dogs and rainbows? And there are absolute things that you need help to get through. And we do such a bad job. I mean, the traditional postpartum care is, you don't see your OBGYN until 6 weeks later.
Yeah.
I mean, by 6 weeks, you've either gotten some stuff figured out or it's gotten pretty bad. And it's pretty common that, because you're taking the baby in at the 1 week visit or the 2 week visit, that the pediatrician is the first one to see. And they're actually having to train pediatricians to be like, pay attention to mom, because, she's not going to see anybody for another month.
That's where I took my first and passed with flying colors my first depression inventory that I should have failed. Like I was not okay,
yeah.
severely not okay by that point.
Right. And I remember I told my OBGYN, and I actually gave birth in Switzerland, which is a whole nother story. But I told my OBGYN at that postpartum visit, that 6-week visit, I was like, I really am not doing well, and I was, telling the stories about how I was really unhappy. And she said to me, yeah, I had a woman one time who was postpartum and told me she wanted to stand in front of a bus. And I thought, well, postpartum's hard. And I was like,
or what I heard too is, oh, you're a first time mom. Like, of course you're nervous. I'm like, no. Being nervous about, I don't want my wet, soapy baby to slip out of my hands in the bathtub. That's a rational, like you're learning how to do a thing for the first time. That's a rational nervousness. Having some of the invasive, intrusive thoughts that I couldn't stop in my head that were more, it took me years to even repeat them to my husband, but that were more shocking than anything that a horror film director could possibly dream up. That's not normal. So we need to stop sort of patting women on the head and patronizing them in that period around, oh, it's okay. Like, of course you pee your pants and you're nervous. Like, yeah, the baby, no big deal. Move on. And of course the baby's healthy. So that's all we care about.
Exactly.
Yeah. This has been so incredibly helpful. And I have about 8,000 questions that I want to ask you. And it'll just open up so many more cans of worms because it's just such an important topic that I'm excited that you were able to come on because it's just so important to all of us. If people want to get more information or they want to connect with you or learn a bit more, how can they find you?
Yes. So the best way would be to go to my website, which is drladydoctor.com. So it's DR and then spelled out ladydoctor.com. And there you'll find a blog that I post about issues that either I think are really important or that I've been asked to address by some of the people who follow my blog or follow me on social media. You can actually contact me directly on my website. There's a contact me link. And if you have specific questions, either about your health or questions that you'd like me to address in a blog post, please feel free to reach out to me there. There's also a list of resources on my website that I call She Sources, and they are really vetted websites that provide excellent information about a broad range of sexual and reproductive health. So if you're looking for something that you don't find on my blog and you don't feel like asking me, you can probably find the answers on one of those websites.
Yeah.
And then you can also reach out to me on social media as well. I'm on Instagram and Facebook.
That's wonderful. I'll link to all those things on your show notes page. And one word that I want to call out that you said, your resources are from vetted websites. Man, if there is not a bigger cesspool on the internet that is things around women's health and babies and momming and all the stuff, like you can go down a really nasty place and get to some really terrible information. So I love that you have that out there that has been vetted by a professional, a medical professional who knows what she's talking about. So I appreciate you putting that together and sharing it with us.
Absolutely.
This has been wonderful. I'm so grateful that you were willing to come on and share this information with us. I know people are going to reach out to you and have their own questions, but I just so appreciate you being here and just sharing this amazing knowledge with us. This has been great.
Well, I really appreciate what you do. So thank you so much.
All right, you guys, I really hope you enjoyed that interview and got a lot of information out of that interview with Dr. Kelly Culwell. Now, before I dive into the things that I want to highlight from this interview, I want to start with a quote that I read on Instagram. I'm going to totally butcher this woman's name. I think her name is Nairia Wahid. I'll link to her Instagram in this show notes page, but it's this incredible poem. It's a section of a poem, and it reads, "Be softer with you. You are a breathing thing. A memory to someone, a home to a life." And I just thought that was so poignant and so perfect in terms of the way that we as women should think about how important we are and how important our health is to ourselves. Like, our bodies are home to our life. They are the container that carries around our soul and carries around our life in this world. But also, we are such important people to the other people who are in our lives. Like, we are memories to some people and support mechanisms to some people and caretakers and all the things. And that means we're very important and we deserve to be taken care of, and we deserve to take care of ourselves. And so with that, thought in mind, let's dive into a few things from this week's episode. The first thing that I want to talk about today is the discussion that Dr. Culwell and I had around the way that we are brought up to feel shameful about our bodies. And I mentioned this a little bit in the intro of this episode around feeling really conflicted about whether I should hit the explicit button. Like, I shouldn't have to. I shouldn't have to worry about, the notion that we said the words vagina and vulva and spoke so openly in this episode. I shouldn't have to worry about how that might offend someone or gross someone out. Again, I hit the button because I didn't know if there would be little ears in the room who, might not be quite at a point that they're ready to learn about more adult information like this. They might not quite be at that point to learn about it in this way, but we shouldn't ever have to feel ashamed about our bodies. And, we kind of giggled and whatever about the word moist and panties and things like that. And you're probably like cringing as I say that again right now, but think about why that grosses you out and why things that have to do with a part of your body, why that's so gross. And why it's not gross for example, men. They are not grossed out by their genitals. We are just brought up to feel so much shame around our bodies, and it's to our own detriment. Not only does that shame keep us from getting the information we need to get about ourselves to keep ourselves healthy and asking the questions that we need to ask in order to get that information, but it really plays over into a lot of other areas of our lives. And in particular, one episode that I want to call out, I believe it was episode 83. It was with Jamie Thompson. She is a holistic sex coach. Shame around our bodies can impact the way that sex plays into our lives and our relationships. And I would encourage you, if you are at all interested in this topic that we talked about today, to check out that topic as well, because they are so interconnected. So number one, I had to start off this outro with talking about that notion of shame and how we shouldn't have to feel ashamed about such a fundamental part of our body. Number two, I want to highlight how wonderful that conversation was about, it was kind of twofold, the sort of Vagina 101 conversation that we had, and then also how to make the most out of your appointment with your doctor, making sure that you're coming in with relevant information, making sure that you're taking care of and tracking your symptoms, and that you know when things started happening and how, what makes them better and worse, and really have a good handle on what's been going on with you. And then last, that you feel empowered to ask any question that you need to ask, to bring up any symptom that you need to bring up, because that is literally the role of that person who is there, is to serve you and make sure that you are as healthy as possible and that they can help you with whatever it is that you bring up. I guarantee you the things that, Kelly said in this interview were echoed by my husband so many times, when he doesn't share details with me about any of his patients, but he'll come home and say, gosh, there was a person today that I really could have helped, but it took so long to get this person over feeling weird about just asking me about something so straightforward. Like, their problem ultimately was not shocking, was not gross to me, was not embarrassing. Like, I'm here to help them and I can help them, but I can't do it unless they're sharing with me what's going on. So please, please, please do what you can to make the most out of those appointments, because again, your health is important and you are an important person. And the last thing that I want to highlight, and I am going to go here, I want to highlight this notion of the postpartum period and making sure that you are taking care of not just that new little life that you brought into the world, but taking care of yourself as well. Before I hopped on to record this outro, I went back and I looked, and it was actually episode number 51 where I shared my experience with postpartum anxiety and PTSD and all of that complexity after